Hello, everyone. Have you ever gone to a doctor or even in a dental office and felt like there was some area of misunderstanding, like you were not really well understood, like your concern were not maybe properly addressed? Could it be that there was a break in communication? So yes, today what we're going to do is talk about the importance of communication for you to have an optimal dental visit, dental treatment, dental health. And I'm Dr. Valerie Mukanga with Healing Wings Dental, which is a place where we help our patients maintain and or regain their oral health so that they can soar in life. So anyway, yes, I'm talking about communication today because I feel that it's very important. And many times, people may not understand. They may understand that communication is the key in many different areas of their lives, maybe like in the job place or maybe like in the marriage. They don't fully understand that it's as equally important to be able to foster a good communication between you and the doctor who's going to be evaluating you, treating you, and administering help to you. So, where is communication essential? Pretty much in every areas. When you feel that you have a concern, say for example, you want to be seen by a dentist because you want to have better teeth, or you want to have a better smile, or you have pain somewhere. It's important for you to communicate, and that from the very beginning. So that means even when you call to set up an appointment, it's important for you to communicate well with the person who's picking up the phone. And when I say that, you want to give, full disclosure as far as, what it is that you already know. You know why you're calling, you know what you would like to get done. It's important for you to be able to address that with the person that you're speaking to, the person on the phone, so that they know how to appoint you accordingly. Say, for example, you have pain and you're calling because you fell or something, and you broke a tooth. It's important for you to give that information because now the person setting up an appointment for you knows that you need a little bit more time allocated for you, just not just so that an exam and x-ray can be done, perhaps a clinic can be done, but that's a true emergency because we don't know whether that tooth will need to be restored right away, or if something needs to be done right away. So it's important for you to actually give details as far as like what you're calling for. As far as insurance are concerned, many times, we ask people, or the front desk would ask people, the person who are calling or picking up the phone call would ask the person trying to make an appointment, do you have insurance? And sometimes people do have insurance and they don't give the information, like, no, I don't have insurance. Or they have insurance, they give one card, but then they come to the appointment, and once the treatment plan is given, now all of a sudden it's like, oh, by the way, I have a second insurance. It's important for communication to be well established and for that information to be given at the day of the appointment or to be sent to the office. Why? Because there's a difference. If you have no insurance, then we are able to see you that way, knowing that you don't have insurance. But if we think that you don't have insurance and all of a sudden a treatment plan is rendered and now you're providing the insurance, it's only going to prolong things because yes, calling insurance offices to verify benefits of insurance, that can be a process that can take a long time. Yesterday, for example, Sochi, which is the lady that verifies insurance in our office here in Wings Dental, she was on the phone trying to verify insurance for a patient for more than an hour. She was tossed from one place, one person to another, to another, to another. And thank God, finally, she was able to obtain the information. And so, if that happens when you are, seeking treatment or wanting to have treatment and you are in pain, for example, this is time that we are waiting, and perhaps we are no longer going to be able to see you or to render treatment the same day because it has taken a long time. And we also find ourselves in instances where someone has an insurance, you provide, and then they're up the person who shares the treatment plan with them and the modalities of payment, and the coverage that the insurance is going to cover. All of a sudden it's like, oh, by the way, I have a second insurance. And that's the same thing. It's going to take a long time. Have someone having one insurance or having many, there's a difference, because you have to know which one is the first insurance, which one is the second insurance, and perhaps the insurance card that you had provided was for the secondary insurance, and all of a sudden things, fall apart in that, it's not as smooth a process as we would have thought. So it's very important to communicate, give those sorts of information so that you can be treated in a timely manner. So you want to disclose everything that you do know. Another area of communication that kind of sometimes, make things not as smooth as we would want would be to disclose information about your health. And many times when people come to the dentist, they feel like, well, I have diabetes, so maybe I have headaches. That has nothing to do with teeth, so I'm not necessarily going to provide information. And once we give you, the medical information for you to, the medical history documents, dental history documents, and we ask you to fill that to the best of your knowledge. Some people know that they have some conditions and they don't let us know. For example, is it easy? Do you bleed for a long time when, treatment is rendered? Or maybe, have you ever experienced dental anxiety or things like that? Those are things that are very important for you to let us know. Or are you on medication? Somebody might be taking some blood thinners of some sort, and then, you don't disclose that, and the doctor now, the dentist, does not know that information. Say, for example, you needed to have some sort of treatment, and then there's induced bleeding, and because you're on blood thinners, all of a sudden you start having a problem. And now, it may be a situation where we have to call maybe, an ambulance, because now you're bleeding and we can't control the bleeding. And that's over something that you could have disclosed, something that you knew about, but you felt like it was not necessary for you to provide that information, with the doctor. Or say, for example, you've had you have a condition and your doctor, we need a clearance, because the doctor would have preferred that we give you prophylactic antibiotic, which is a big word just to say that we need to give you medication 1 hour before treatment, where you don't give this information and all of a sudden you start having problem afterwards. So having your adequate and accurate medical history is very, very, very important for a dentist to know. Don't feel like, you having COPD or asthma is nothing that the dentist need to necessarily know. We need to make adjustments for your treatment when you have different conditions. So you'd want to definitely, you communicate with your doctor so we can treat you accordingly. Another area that we need your collaboration and communication with is during treatment. So you have some people who, you have experienced dental anxiety in the past. It's important for the doctor to know that, because, we know how to coach you through the process and try to calm you down. Perhaps, we're going to give you nitrous oxide or laughing gas, which is something that's going to calm you down or relax you. Or maybe in the past, you have been a person that, having had some sort of treatment modality. For example, some people can, and very few people can't necessarily stand nitrous oxide. So it's important for you to let us know. That way we know that we're not going to give it to you. Suppose, we are giving you some anesthesia, and in the past you have felt like, taking that, maybe your heart started beating fast. It's important for you to let the doctor know that, because then we can administer some anesthesia that does not have epinephrine, for example, which can induce your heart to beat fast. So there's some things that you want to let us know. And during treatment as well, if you feel pain for some reason, we have provided you anesthesia, but we go in treatment and you feel some pain, raise your left hand, if the hand that's told you, advised for you to lift up, because I'm a right-handed person, and so I treat my patient from their right. But if the doctor, is a lefty, ENT, that's a different situation. Anyway, you want to let the person know because we want you to have a pleasant visit. There's no need for you to feel any sort of pain during treatment. That's the reason why we numb you and we provide you with, first of all, topical anesthesia that's going to help things so that you feel if you're going to be sensitive during when we administering anesthesia, then that helps a lot. But raising your hand or letting us know that you're feeling pain, or maybe you need to use the restroom, you need a break, or maybe you need suction or something, it's important for you to communicate during treatment so that you can have pleasant visit. So yeah, in short, that's what I wanted to talk to you about today. The importance of communication at every level. You want to establish good communication with your doctor. That way we can treat you well. Your dentist, any other medical professional provider that you do have, your doctor, your physician, or any specialist of any kind. You want to communicate with them so that you can be taken care of in a good manner or in a good way. Okay, so that's what I wanted to talk to you about today. Communication goes a long way, not just in your daily life, but even when you go to a dentist, when you go to a doctor to be treated. Anyway, if you have found this information to be valuable, please I'm asking you to go ahead and share the information with the people in your life, so that they can also benefit from this type of information. And also, please don't hesitate to subscribe to our channel, or to like our comments. If you have any questions, don't hesitate to ask them. We will answer your questions, and maybe we can also create a video that will address your concern, or answer your questions. And again, we are Healing Wings Dental. We are located at 4101 West Greenhouse Boulevard, suite number 317 in Arlington, Texas. Our zip code is 76016. Also, feel free to call us to set an appointment for yourself, for your family members. We see patients of any age, from babies to their oldest. We provide treatment even for babies, and so that your family can be taken care of. And calling us, we are able to provide you with an appointment in a timely manner. You really don't have to wait 3 months, 2 months, a month to be seen. We are here to help you. All right. That being said, have a great day, and we'll talk to you next time. Bye. Be blessed.